Chapter 9 Therapeutic Relationships and the Clinical Interview. A nurse assesses a confused older adult. The nurse experiences sadness and reflects, "The patient is like one of my grandparents, so helpless." What feelings does the nurse describe? Answer is countertransference. Countertransference is the nurse's transference or response to a patient that is based on the nurse's unconscious needs, conflicts, problems, or view of the world. Next, which statement shows a nurse has empathy for a patient who made a suicide attempt? The answer is, "You must have been very upset when you tried to hurt yourself." Empathy permits the nurse to see an event from the patient's perspective, understand the patient's feelings, and communicate this to the patient. The incorrect responses are nurses centered, focusing on the nurse's feelings rather than the patient's, belittling and sympathetic. Next, after several therapeutic encounters with a patient who recently attempted suicide, which occurrence should cause the nurse to consider the possibility of transfer? Answer: the nurse feels unusually happy when the patient's moods begins to lift. Strong positive or negative reactions toward a patient or an over-identification with a patient signal possible countertransference. Nurses must carefully monitor their own feelings and reactions to detect countertransference and then seek supervision. Realistic and appropriate reactions from a patient toward a nurse are desirable. One incorrect response suggests transference. A trusting relationship with the patient is desirable. Next, a patient says, "Please don't share information about me with the other people." How should the nurse respond? The answer is, "I won't share information with others without your permission, but I will share information about you with other staff members." A patient has the right to know with whom the nurse will share information and that confidentiality will be protected. Although the relationship is primarily between the nurse and the patient, other staff members need to know pertinent data. The other incorrect responses promote incomplete disclosure on the part of the patient, require daily renegotiation of an issue that should be resolved as the nurse-patient contract is established, and suggest mutual problem solving. The relationship must be patient-centered. Next, a nurse is talking with a patient and 5 minutes remain in the session. The patient has been silent for most of the session. Another patient comes to the door of the room, interrupts, and says to the nurse, "I really need to talk to you right now." What action is most appropriate? Answer is, telling the patient who interrupted, "This session will end in 5 minutes, then I will talk with you." When a specific duration for a session has been set, the nurse must adhere to the schedule. Leaving the first patient would be equivalent to abandonment and would destroy any trust the patient had in the nurse. Adhering to the contract demonstrates that the nurse can be trusted and that the patient and the sessions are important. The incorrect responses preserve the nurse-patient relationship with the silent patient but may seem abrupt to the interrupting patient. Abandon the silent patient or fail to observe the contract with silent patient. Next, termination of a therapeutic nurse-patient relationship with a patient has been successful when the nurse engages in what action? The answer is, discusses with the patient changes that have happened during the relationship and evaluates the outcomes. Summarizing and evaluating progress help validate the experience for the patient and the nurse and facilitate closure. Termination must be discussed. Avoiding the discussion by spending little time with the patient promotes feelings of abandonment. Successful termination requires that the relationship be brought to closure without the possibility of dependency, producing ongoing contact. Next, what patient behavior is desirable outcome for the orientation stage of a nurse-patient relationship? The answer is building rapport and trust with the nurse. The development of rapport and trust is necessary before the relationship can progress to the working phase. Behaviors indicating a greater sense of independence, self-responsibility, and resolved transference occur in the working phase. Next, during which phase of the nurse-patient relationship can the nurse anticipate that identified patient issues will be explored and resolved? The answer is working phase. During the working phase, the nurse strives to assist the patient in making connections among dysfunctional behaviors, thinking, and emotions, and offers support while alternative coping behaviors are tried. Next, at what point in the nurse-patient relationship should a nurse plan to first address termination? The answer is during or in the orientation phase. The patient has a right to know the conditions of the nurse patient relationship. If the relationship is to be limited, then the patient should be informed of the number of sessions. If it is open ended, then the termination date will not be known at the outset, and the patient will know the issue will be negotiated at a later date. The nurse is responsible for bringing up the topic of termination early in the relationship, usually during the orientation phase. Next, why should the nurse a con- introduce the matter of a contract during the first session with a new patient? The answer is to explain the participation and responsibilities of each party. A contract emphasizes the nurse's work with patient rather than doing something for the patient. Working with is a process that suggests each party is expected to participate and share responsibility for the outcomes. Contracts do not, however, stipulate roles or feeling tone or that premature termination is forbidden. Next, as a nurse escorts a patient being discharged after treatment for major depressive disorder, the patient gives the nurse a gold necklace with a heart pendant and says, "Thank you for helping mend my broken heart." Which is the nurse's best response? Answer is, "I am glad I could help you, but I can't accept the gift. My reward is seeing your renewed sense of hope." Accepting a gift creates a social rather than a therapeutic relationship with the patient and blurs the boundaries of the relationship. A caring nurse will acknowledge the patient's gesture of appreciation, but the gift should not be accepted. Next, which remark by a patient indicates passage from the orientation phase to the working phase of a nurse patient relationship? The answer is, "I want to find a way to deal with my anger without becoming violent." Thinking about a more constructive approach to dealing with anger indicates a readiness to make a behavioral change. Behavioral change is associated with the working phase of the relationship. Denial is often seen in the orientation phase. It is common early in the relationship before rapport and trust are firmly established for a patient to express difficulty in talking about problems. Stating skepticism about the effectiveness of the nurse patient relationship is more typically a reaction during the orientation phase. Next, a nurse explains to the family of a patient who is mentally ill how the nurse patient relationship differs from social relationships. Which is the best explanation? The answer is the focus is on the patient. Problems are discussed by the nurse and patient, but solutions are implemented by the patient. Only the correct response describes the elements of a therapeutic relationship. The remaining responses describe events that occur in social or intimate relationships. Next, how should a nurse who wants to demonstrate genuineness with a patient diagnosed with schizophrenia do so most effectively? The answer is by using congruent communication strategies. Genuineness is a desirable characteristic involving an awareness of one's own feelings as they arise and the ability to communicate them when appropriate. The incorrect options are undesirable in a therapeutic relationship. Next, a nurse caring for a withdrawn, suspicious patient recognizes the development of feelings of anger toward the patient. How should the nurse respond? Answer is by discussing the anger with a clinician during a supervisory session. Nurse is accountable for the relationship. Objectivity is threatened by strong positive or negative feelings toward the patient. Supervision is necessary to work through a countertransference of feelings. Next, a nurse wants to enhance the growth of a patient by showing positive regard. What nursing action is consistent with this wish? Answer is staying with a tearful patient. Staying with a crying patient offers support and shows positive regard. Administering daily medication and making rounds are tasks that could be part of an assignment and do not necessarily reflect positive regard. Examining feelings regarding a patient addresses the nurse's ability to be therapeutic. A patient says, "I've done a lot of cheating and manipulating in my relationships." What non judgmental response by the nurse is most appropriate? The answer is, "How do you feel about that?" Asking a patient to reflect on feelings about his or her actions does not imply any judgment about those actions, and it encourages the patient to explore feelings and values. The remaining options offer negative judgments. Next, a patient says, "People should be allowed to commit suicide without interference from others." A nurse replies, "You're wrong. Nothing is bad enough to justify death. What is the best analysis of this interchange? The answer is differing values are reflected in the two statements. Values guide beliefs and actions. The individuals stating their positions place different values on life and autonomy. Nurses must be aware of their own values and be sensitive to the values of others. Next, which issues should a nurse address during the first interview with a patient diagnosed with psychiatric disorder? Answer is relationship parameters, the contract, confidentiality, and termination. Relationship parameters, the contract, confidentiality, and termination are issues that should be considered during the orientation phase of the relationship. The remaining options are issues that are dealt with later. Next. During the first interview, a nurse notices that the patient does not make eye contact. What can the nurse correctly assume from this behavior? Answer is the need for more information is required to draw a conclusion. The data are insufficient to draw a conclusion. The nurse must continue to assess. Next, which behavior shows that a nurse values autonomy? Answer is helping the patient weigh the consequences of their behaviors and decisions. A high level of valuing is acting on one's belief. Autonomy is supported when the nurse helps the patient weigh alternatives and their consequences before the patient makes a decision. Autonomy or self-determination is not the issue in any of the other behaviors. Next, as a nurse discharges a patient, the patient gives the nurse a card of appreciation made in an arts and crafts group. What is the nurse's best action? Accept the card while recognizing the effectiveness of the relationship and the patient's thoughtfulness. The nurse must consider the meaning, timing, and value of the gift. In this instance, the nurse should accept the patient's expression of gratitude. Next, a patient says, "I'm still on restriction, but I want to attend some off-unit activities. Would you ask the doctor to change my privileges?" What is the nurse's best response? Answer is, that's a good topic for you to take up with your doctor. Nurses should encourage patients to work at their optimal level of functioning. A nurse does not act for the patient unless it is necessary. Acting for a patient increases feelings of helplessness and dependency. Next, a community mental health nurse has worked with a patient for 3 years but is moving out of the city and terminates the relationship. What is the role of the new nurse who begins working with this patient? The answer is beginning at the orientation phase. After the termination of a long-term relationship, the patient and new nurse usually have to begin at ground zero. The orientation phase to build a new relationship. If termination is successfully completed, then the orientation phase sometimes progresses quickly to the working phase. Other times, even after successful termination, the orientation phase may be prolonged. Next, as a patient diagnosed with mental illness is being discharged from a facility, a nurse invites the patient to the annual staff picnic. What is the best analysis of this scenario? The nurse's action blurs the boundaries of the therapeutic relationship. The invitation creates a social relationship rather than a therapeutic relationship. Next, a nurse says, "I am the only one who truly understands this patient. Other staff members are too critical." What does the nurse's statement indicate? Answer, boundary blurring. When the role of the nurse and the role of the patient shift, boundary blurring may arise. In this situation, the nurse is becoming over-involved with the patient as a probable result of unrecognized countertransference. When boundary issues occur, the need for supervision exists. The situation does not describe sexual harassment. Data are not present to suggest positive regard or advocacy. Next, which descriptors exemplify consistency regarding therapeutic nurse-patient relationships? Select all that apply. Having the same nurse care for a patient on a daily basis. Providing a schedule of daily activities to a patient. And setting a time for regular sessions with a patient. Consistency implies predictability. Having the same nurse see the patient daily, providing a daily schedule of patient activities, and setting a regular time for sessions help a patient to predict what will happen during each day and to develop a greater degree of security and comfort. Encouraging a patient to share initial impressions of staff and giving advice are not related to consistency and would not be considered a therapeutic intervention. Next, a nurse ends a relationship with a patient. Which actions by the nurse should be included in the termination phase? Select all that apply. Answer is focus dialogue with the patient on problems that may occur in the future and help the patient express feelings about the relationship with the nurse. The correct actions are part of the termination phase. The other actions are used in working and orientation phases. Next, a new psychiatric nurse is providing care to a parent diagnosed with bipolar disorder. This nurse angrily recalls embarrassing events concerning the parent's behavior in the community. Select the best way for this nurse to cope with these feelings. Select all that apply. Seeking ways to use the understanding gained from childhood to help patients cope with their own illnesses. And recognizing that the feelings may add sensitivity to the nurse's practice, but supervision is important. The nurse needs to explore these feelings, and an experienced psychiatric nurse is a resource who may be helpful. The knowledge and experience gained from the nurse's relationship with a parent who is mentally ill may contribute sensitivity to a compassionate practice. Self disclosure and suppression are not adaptive coping strategies. The nurse should not give up on this area of practice without first seeking ways to cope with the memories. Next, a new nurse tells a mentor, I want to convey to my patients that I am interested in them and that I want to listen to what they have to say. Which behaviors are helpful in meeting the nurse's goal? Answer, introducing self to a patient and identifying own role, using facial expressions that convey interest and encouragement, and assuming an open body posture and sometimes mirror imaging. Trust is fostered when the nurse gives an introduction and identifies his or her role. Facial expressions that convey interest and encouragement support the nurse's verbal statements to that effect and strengthen the message. An open body posture conveys openness to listening to what the patient has to say, and mirror imaging enhances patient comfort. A desk would place a physical barrier between the nurse and patient. A face-to-face stance should be avoided when possible, and a less intense 90 or 120-degree angle is used to permit either party to look away without discomfort. And once introductions have been made, the nurses focuses the interview on the patient by using open-ended questions such as, where should we start?